Well, ladies and gentlemen, a very warm welcome once again to eCancer's 5 Minutes With. I'm Richard Sullivan, the Chairman of Trustees for eCancer and Professor of Cancer and Global Health at King's College London. And it's a wonderful pleasure to welcome Dr. Bettina Müller with us today to talk about a paper which I'll introduce in a moment. But let me firstly say a couple of words about Bettina. She's a medical oncologist at the National Cancer Institute of Chile, and she's also the current president of the Chilean Cooperative Group for Oncological Research in Chile. Bettina, very warm welcome to eCancer. Thank you for being with us today.
Thank you for inviting me to speak about this paper. That's very important for us.
Wonderful. So the paper we're actually going to be talking about today is absolutely a remarkable piece of work. And this is it, ladies and gentlemen. It was published in the Journal of Global Oncology last year in May. And the title of it was Social Distances, Economic Crisis During COVID-19 Pandemic, Reduced Cancer Control in Latin America and will result in increased late-stage diagnosis and expense. Incredibly important topic here, Bettina. Before we dive in and talk about the paper, maybe just give our listeners a sense of the work you've been doing leading up to the publication.
Yeah, this was really a project we did under the leadership of Dr. Tabaré Vázquez. He, in May 2020, actually invited colleagues from 9 countries from Latin America to get together with clinicians, public health specialists, health economists, and epidemiologists to see what the impact of the COVID-19 crisis would have on cancer control, as we saw that once again cancer control would be step back inside of this global crisis. So we got together and we wanted to analyze the characteristics of the health systems of these different Latin American countries, see how they did cancer control in every country. Second, compare the measures that were taken in response to the pandemic in each country, and gather data about the impact of the pandemic on cancer care, as we saw that we need some data to really stress the importance to take measures to address cancer patients in this context. So, and the ultimate goal was to propose measures to mitigate the negative impact we saw that this pandemic would have on cancer control. So we delivered actually a paper, position paper in fall 2020 that was distributed to different authorities, but then saw that we have also to public so that this would be for people to reference to. So this was why we did this paper.
Yes, wonderful. And I mean, extraordinarily strong paper. I mean, the fact you managed to cover countries as diverse as Brazil, Uruguay, Mexico, Peru. I mean, that's, I think one of the really great strengths is, as I say, that diversity of ecosystems in which you look. Maybe let's just come on to talking a little bit about some of the, frankly, shocking findings, actually, from the data you collected. And maybe you can give, again, our listeners basically some highlights of those top line findings, Bettina.
Yeah, first of all, we saw that, as you say, this was really different countries in Latin America, very big countries like Brazil and Mexico, and smaller countries like Uruguay or Honduras, with different economic situations. But we saw that really across the board, health expenditure is low in these countries. Even in Chile, with this part of the OECD, but health expenditure is low. And we also have a fragmented healthcare system, so very high inequities in the health system. But we saw also that national cancer plans were developed or had been developed recently. So this was also a common finding. The response to the COVID-19 pandemic was quite similar also, with lockdown measures and allocation of the resources to the management of the pandemic. also saw that guidelines were implemented to adapt cancer treatment and management to the new situation. But then diving into the data we tried to gather from different sources, we saw really that comparing March to June 2019 and 2020, the same period, we saw that across the countries there was a reduction in cancer diagnosis and treatment. And we saw some indicators like first-time visits, like pathology, surgery, chemotherapy, radiotherapy, and also the early diagnosis or prevention strategies as mammographies or fecal occult blood tests, and also the pap smear, very important in our countries, as cervical cancer is still a huge problem. So we also estimated with economists how this would impact the costs for the treatments. As you know, more advanced disease need more treatments, more multidisciplinary treatments, more longer treatments, and also more with higher costs. So this was also a finding we could elaborate with the data we could gather. So now then we said, well, what should we do to mitigate this now? And then we really try to build a consensus that the countries should implement measures to mitigate these findings, you know, and also address the more vulnerable populations that were hit much more from the crisis than the people with the better economic background. So this is also the finding we should take into consideration. We should guarantee the access to oncology services, and we should really build care networks to do this. In this fragmented health system, some people are excluded and some people have better access to services. So we should really take into solidarity in this. And this was like the last sentence of the paper. I like it very much. You know, we have to really think in everybody, and also the people who don't have access to health systems. But we also need registries, we need research, and we need international collaboration to really see what this pandemic has done to the cancer control measures and what it will do in the future. As we know now, we didn't know this in May 2020, that this pandemic is still with us, is still giving us problems. And 2 years now, and we really have to see what we will do with these diseases that are not urgent, but very important. You know?
Yeah, so let me just pick up on that's wonderful, because let me just pick up on that. I mean, there are, as you say, the figures are absolutely stark, a decline of between 28% and 70% for cancer surgery. I mean, this is essentially, we're talking about curative cancer surgery here, reduction. I mean, those are vast. So I guess, you know, looking to the future now, what you're going to see obviously is a lot of premature mortality and morbidity as a result of delays in diagnosis, and not just reductions in treatment, but simply not getting treated as people come in with more advanced disease. Where is Latin America going with this new Omicron wave? And what do you think this is going to add in terms of difficulties and delays to the systems? Do you see additional problems coming downstream this year in 2022?
Yeah, I think that this is just a personal like appreciation. You know, I don't have data right now, but I know that there is there are huge differences in access to vaccination in Latin America. In Chile, we have the good situation that a high percentage of the population have access to the vaccination. Everybody actually, and we just had the booster vaccination. So I think that Omicron will hit Chile with high numbers, but probably the health system will not be stressed in the same way as other populations where the vaccination isn't so highly accessed as in Chile or Uruguay, for example. So I think the health systems of, for example, Brazil, which is not such a big country, or Mexico, they will be in a higher problem than smaller countries with higher access to vaccination. So I also, and this will postpone once again treatment for cancer patients. And I think the problem we saw, I remember that years ago, we saw that there is a tsunami of cancer patients in the developing countries because of aging populations and Western lifestyle. And now the pandemic hit us. So we already see this. We are very stressed in our hospitals. We don't have the human force to attend all the people that are seeking health care. So this will be really a big problem to address.
Yes, I mean, this is, I think, a hugely important paper. Dr. Bettina Müller, thank you very much indeed. For those of you, again, wanted to read it in full, it's in the Journal of Global Oncology. It was in the May issue last year. And I think it's really illuminated what has been an extremely complex and difficult pandemic on national cancer control planning and cancer outcomes across the whole of Latin America. Dr. Bettina Müller from the National Cancer Institute of Chile, thank you so much for joining us today at eCancer and for giving us your time and insights to what's going on. And really just to congratulate you for a fantastic piece of work and for your ongoing research in this area. Thank you.